If your tooth needs a root canal, it's because the inside of it is infected. Every tooth has an inside, has a little hollow chamber inside of it. It's filled with the cells that made your tooth when you were a little kid. And they align themselves in the right way, and then they make the tooth and they end up trapped inside. If you have a little cavity, we drill it, we fill it. If you have a medium cavity, we drill it, a little more, clean it all out, put in a bonding agent, and put in a nice filling. If you have a huge cavity, we shape it, we drill it, we do everything, we make sure it's okay, seal it off. Maybe we put a crown on that tooth and put a cap on that tooth. But whatever you're doing, you're removing the diseased part and then replacing it with health and porcelain and materials. That's all a root canal is, in theory. It's just, now the infection that was in the tooth and the decay that was in the tooth has reached the nerve, let's clean that out too. And that's great in theory. In practice, it's a lot of detail. It's a lot of work. I compare it to when you're painting your living room. People say, oh, honey, paint the living room this weekend. Okay. Well, you got to cover the furniture. All right, I covered the furniture, and then take out the paintings. Oh, wait, there's some scrapes. I got to spackle those. Okay, I get spackle. Now it has to dry for 24 hours. Then you have to touch that up with primer. And then, before you know it, you've spent 4 days preparing for the 2 hours it takes to paint the room. And that's how a root canal ends up. It's a lot of preparing, a lot of working on the tooth, 20, 30 minutes, so that then I can plug it and fill it up with special stuff. And then your tooth is hollowed out and filled in, and technically inside it's dead, but your jawbone is still holding it, your gum is still holding it, your fingernail is dead, but you can feel it moving around and doing stuff. Your tooth still works. It's still a tooth. We put a crown on it for strength on top, and you've got a tooth that can last another 10, 20 years, easy, probably the rest of your life.